We're so honored now to be joined by Dr. Stephen Libutti. He is the Senior Vice President of Oncology Services at RWJ Barnabas Health, the official healthcare provider, of course, of the New Jersey Devils. And the Hockey Fights Cancer initiative by the NHL has been around for about 2 decades now. Doctor, why is what they're doing so important?
Well, it's so important to bring attention to this disease, and so much of what we can do in terms of positive intervention for patients is for people to understand how important it is to get early screening and early detection of cancer. And the fact that the NHL brings attention to cancer as a problem and really pays tribute to our patients and their strength and perseverance, I think is incredibly important.
Yeah, and I think on a night like this, everyone just feels so inspired. Of course, we have Brian Boyle on the Devils, so it feels a bit closer to home, but there are so many cancer survivors out there, and their bravery and their strength through everything that they've been through, many of us can't even imagine. Why does it mean so much that they're honored in such a way here today?
Well, if you can imagine, probably the worst words you can hear is that you have cancer. And it's critically important that cancer patients receive incredible support, help, navigation through their cancer diagnosis. And the fact that we can wrap a blanket around them, whether it's at an NHL game like this or when they come to receive their care, I think is so important for them to have the best possible outcome. And so that's why a night like tonight is so special and so important.
Yeah, it really is. And as you mentioned, just such difficult words to hear, but you guys are doing everything you can, along with the Cancer Institute of New Jersey, of course, to make that road easier for folks. So can you just build upon, I guess, exactly what you guys are doing and the patient-centric care that you provide there, as well as education?
Absolutely. So we see our role as incredibly important, not only in the treatment of patients and in making progress and new discoveries, but also in education, not only for the patients themselves and their families, but for the community, to understand what they can do to try to reduce their risk of cancer or get early screening and early detection. We work very closely with the state of New Jersey on a program called Screen NJ, which is a screening program for colorectal and lung cancer, 2 very high incidence cancers in the state of New Jersey. And as the state's only National Cancer Institute designated comprehensive cancer center, we feel that our role in promoting education and knowledge for both patients and their families and the citizens of the state of New Jersey is critically important.